We'll start with the drugs. Ozempic.
Drug that helps you lose weight.
Some people using the weight loss drug Ozempic.
One of the world's most talked about drugs.
That everyone has been talking about, be it Ozempic, be it Mounjaro, be it Wegovy. How do we know what do we have to use?
These medications are only given in certain indications. अगर आप diet, अगर आप exercise और आपका behavioral changes करने को ready नहीं हो, तो nothing is going to work.
And who is the ideal candidate for these drugs from a medical standpoint of view?
There are some really genuine patients who come asking for this medications, but at the same time you also have another group of patients who unfortunately, with the influence of social media.
Just today in the newspaper I read that the semaglutide prices are going to reduce. The patents have expired. The Chinese have already started making it. It will soon flood the Indian market. What do you think is going to be the effect of that in India? Should we be concerned?
I think
Everybody who's listening to this should know that if you're looking for a quick, easy way to lose weight, you also have to go through these complications.
when they were doing these trials in animals, especially in rats, they used to get thyroid cancers. That is why.
And do you feel that the entertainment industry in India
एक जिंदगी जीनी है, जो भी शॉर्टकट डॉक्टर बोल रहा है लो.
has even ruined it more for youngsters? Because in India, people are very influenced by celebrities. When it comes to taking these medicines, do you feel that once you stop, the weight does come back? Have you seen that in results?
So,
India is the diabetes capital of the world. Ozempic, Wegovy, Mounjaro, everyone is talking about them. But is anyone actually talking about the truth? Welcome to Find Out with Ragini, and today I'm joined by Dr. Hrishikesh Salgaonkar, who's a bariatric surgeon at Fortis Hospital, Mulund, with over 13 years of experience and training across India, the UK, and Singapore. We are breaking down how these drugs really work and what nobody tells you about the risks, and why lifestyle changes is the only thing that actually lasts. Thank you so much, Dr. Hrishikesh, for being here on Find Out with Ragini. Today is a supremely exciting day for me because we discuss about Ozempic.
Yeah.
We discuss what is weight loss doing to the Indian ecosystem.
Yeah.
And most importantly, why do we still remain the diabetes country of the world, right? Why don't you introduce yourself to everyone watching, and then we go about asking questions.
thank you, Ragini, for inviting me to this podcast. So, I am Dr. Hrishikesh Salgaonkar. I work in Fortis Hospital, Mulund. I am a consultant bariatric and obesity surgery specialist. So, my main area of expertise is patients who struggle with obesity and who need help. And
So they come to you for asking for
absolutely.
help.
And the purpose of coming to this podcast is also to create that awareness about what are the right and what are the wrong things when it comes to, managing obesity as such, and the problems that come with obesity,
Right.
say diabetes, hypertension,
Diabetes क्यों होता है? Why does it happen? Is it because so there was a lot of myths that we discussed.
Yes.
चावल खाते हैं तो डायबिटीज होता है, बहुत ज्यादा शुगर नहीं खाना चाहिए, शुगर से डायबिटीज होता है, लड्डू से
बराबर,
डायबिटीज होता है.
बराबर.
So please demystify that for us.
So you can't blame one factor. किसी एक रीजन को पकड़ के बोलना मुश्किल है. I would say it is a mix of factor. There's a lot of genetics involved into it. So I don't know whether many people are aware that as Asians, not only as Indians, as Asians हम लोग diabetes को predisposed होते हैं. So we have much more higher rates of young onset diabetes. So typically अगर हम एक Western population के साथ compare करें, तो डायबिटीज़ इंडियन और एशियन पॉपुलेशन में ऑलमोस्ट 10 years अर्लियर आ जाता है. एंड द रीज़न बीइंग कि द टोटल बॉडी फैट परसेंटेज इन एन एशियन एज कम्पेयर टू अ वेस्टर्नर और अ कॉकेशियन is much higher. So if you see the diabetes trend in countries like India, Bangladesh, we may go to Singapore, Malaysia, they are equally high.
Right.
So for the same very reasons, even World Health Organization has changed the guidelines when it comes to obesity definitions.
Okay.
So अगर हम एक वेस्टर्न वर्ल्ड में जाएंगे, बिकॉज आई वर्कड इन यूके फॉर अ लॉन्ग टाइम, देयर व्हेन वी डिफाइन समबडी एज हैविंग सीवियर ओबेसिटी, वी विल से morbid obesity is anything more than 40 BMI.
Okay.
But the same category for Asians is less than 2.5.
Right.
So I would say anybody is more than 37.5 is morbid obesity.
Okay.
So anybody is more than 30 in an Western context will have obesity. बट सेम हम इंडिया में आएंगे तो हम उसको 27.5 पे लाएंगे. दैट इज बिकॉज वी गेट डायबिटीज and we get the obesity associated comorbidities at lower weights and lower BMI as compared to the Western population.
So weight has nothing to do with being diabetic?
It has. We can't. So important to realize that there are two types of diabetes. One is type 1 diabetes,
Okay.
जिसमें unfortunately the body's insulin producing capacity goes down.
Okay.
So they are a different subgroup of patients altogether. Whereas type 2 diabetes has a strict correlation with obesity. So अगर किसी का BMI 25 से lower है and किसी का BMI 40 से ज़्यादा है, so that person will have a 25 to 50% higher risk of having diabetes.
But not necessary, right?
Not necessarily, but it is a very, very clear correlation that
Right.
is there.
So now tell us, जब इतना कुछ हमें data पता है and the health industry in India is also very low. People think that gym is not an activity that needs to be done every day. Or taking care of your health
Yes.
is the last thing that we think. मतलब हमें लगता है कि हम 20 साल की उम्र से 60 साल की उम्र तक काम करेंगे, रोज ऑफिस जाएंगे, that is more important, but we don't see the effects that has had on our body, right? So how do we avoid, or what are the top 3 things you recommend that ये अगर आप अभी से शुरू करें, या anybody from what age, like from the age of 15, we have seen teenagers now going towards working out, right? What are the 3 things you tell us that ये करो ताकि you can avoid being in that zone?
Yeah. So having a healthy diet, what I would say is mindful eating. So making the right choices of food, कि what is good for me, what is bad for me, ये perceptions बहुत जल्दी आने चाहिए, and I think parents have a big role to play in this. Kids will learn from their parents. So अगर parents right choice करते हैं, तो it is very natural कि kid is also going to pick up the right things. Unfortunately, we don't have exercise in our DNA, sadly. So if you go to a Western world, you know, schooling, sports has a very big role to play.
Right.
Unfortunately, we don't have that. We are very good when it comes to education. We have set very good examples, you know, today the top professionals, be it India, abroad, you know, come from India, which is a fantastic thing. But at the same time, you know, we don't have the sporting DNA in our nature.
Yeah.
So exercise does not come naturally to us.
So
And
you suggest that at least start by walking.
Exactly. Simple act of walking. And then quality sleep is equally important. So for a good metabolism, at least a 6-hour sleep is essential. हम जब ओबिसिटी के पेशेंट्स को ट्रीट करते हैं, हम उनको ऑलवेज बोलते हैं कि यू नीड टू हैव एटलीस्ट 6 to 7 hours ऑफ स्लीप. If you are not having that, you are going to have a disturbed metabolism, and unfortunately, you know, your results are not going to be the best.
And that is all correlated, but India में we all think that क्योंकि हम खा रहे हैं इसलिए हम you know, we are putting on weight.
Exactly.
Instead of thinking that we are not sleeping well, we are not moving our body, we are constantly doom scrolling on our phones and sitting at one place.
So there are lot of factors. एक चीज को pinpoint करके गलत बताना is wrong. I would say it is a mix of reasons that are responsible for this.
Now let's come to the that everyone has been talking about, be it Ozempic, be it Mounjaro, be it Wegovy. Just today in the newspaper, I read that the semaglutide prices are going to reduce extremely. They're going to reduce. The patents have expired, so the Chinese have already started making it. It will soon flood the Indian market. These right? How are they different from each other, and how do they work? Because it started with semaglutide, then it went to Ozempic, then it went to Mounjaro. Then I think there was this name starting with R, retraglutide or something, which has now come into the picture. I might be pronouncing it wrong. How do we know what do we have to use, or how are they different?
See, all these medications are basically group of what we call as GLP-1 agonist, na? Glycogen-like peptide 1. So GLP-1 is a naturally occurring hormone, and these are basically synthetic forms, or they mimic that GLP-1 hormone. So typically semaglutide would be what we call as a single agonist, GLP-1 simply, and tirzepatide is what we call as a dual agonist, जिसमें GLP-1 भी होता है, which is glycogen-like peptide, and GIP भी होता है, gastric inhibitory peptide.
और इन दोनों का GLP-1 और GIP का difference क्या है? If you could explain quickly.
So basically both are related to your appetite. They reduce your gastric emptying. Obviously, when companies come up, researchers and scientists come up with new molecules, the main goal is to give slightly better weight loss, and that is where, or to improve the safety profile of that medication. So in our practice, what we see is when it comes to single agonist like GLP-1, the dual agonist, that is GLP-1 and GIP, give slightly more weight loss.
better
But
results.
I wouldn't say कि वो बहुत significant होता है.
Okay.
Now, what a patient wants, and कुछ patients are better with just a simple GLP-1. Some patients are better with GLP-1 or GIP. It is the patient who makes the choice, not the doctor who makes the choice.
Really? That's
So
very
we will,
interesting.
so in my practice, I will put it in front of patients, and they are the one who decide, what is best for them. So.
But isn't it contradicting that हम आपके पास आएंगे as patients, that you tell us, we trust you to tell us what is the best
No,
thing?
so my job is to give them options.
Right.
ना हर किसी का economic profile अलग रहता है, and like I said, I may think that this may work best for them, but patients are happy with certain
Lesser
things.
or more.
So sometimes how patient psychology work is, they feel if there are two components in a I'm better off with taking one drug. ना दो drug से एक drug अच्छा है. So again, you have to give what they are happy with.
And they are more comfortable
exactly,
with, right?
Exactly.
But these Ozempic sort of things that we are now talking about, they were made primarily for diabetic patients,
Yes.
right? There is no awareness. There's so much data. People
Yes.
say good things, bad things, and there's no scientific case study or an awareness or a paper written
Yes.
by doctors or by law professionals saying that this is good for you, this is not, right? So it is all everything that is on the internet that we are seeing. So how does that work?
So see, these were basically brought out to treat type 2 diabetes.
Right.
And they were wonderful. Somewhere down the course of line, what researchers started seeing is कि जब ये किसी diabetic patients के लिए medications देते थे, तो उनमें weight loss भी दिखने लगा था.
Okay.
And that is where obviously after detailed research and detailed analysis, they found out that these drugs are also very good when it comes to weight loss. And then after running good long trials and good studies internationally, they have now come out with these drugs for weight loss. And that is where, so obviously the drugs that we use for weight loss, unka dosage is much higher than sometimes the drugs that we use purely for treating diabetes. And these are FDA approved. So there's a lot of research that has gone in when it comes to managing this medication. Data hai. Now how that data is put out in the public is sometimes unfortunately not in our control. Yes, there is a social media hype. Today, we are a digitalized
economy,
nation.
different country,
so, it is very easy for each and everything to reach every nook and corner of the country. Now, how do we regulate it? As a doctor, there's very little that I can offer. But then our job or my job, and probably, that is why we are sitting here today, is to create an awareness where, we tell people that, these medications should not be taken as an off-label thing. It is very, very important that they have to be taken under the guidance of a registered medical practitioner. And especially people who are accustomed to treat patients with obesity. So when I say I'm talking about an endocrinologist, obesity physician, sleep specialists, doctors, general physicians who manage a lot of patients with diabetes and obesity. So people who manage obesity patients more frequently or who manage diabetic patients more frequently, I think these are the practitioners who should be prescribing this medication.
I'll actually tell you a personal story. My very close friend of mine, she went to a nutritionist. The nutritionist told her that go on and take take Mounjaro or Ozempic, whatever is present. My friend told me it was so easy for her. It was just present with the local medical store. He said, ma'am, it's present, it's for so and so, take it. She had extreme anxiety for like 3 to 4 months. She said, I couldn't sleep, Ragini. I couldn't eat. I had this weird, I felt that everything around me is crashing. And then she said, I went on Reddit and I started doing research, and it is happening, but it is because the pros are shown so much, the cons not so much. So do you think these nutritionists should be giving or guiding folks whether you should take Ozempic, or even fitness influencers for that matter are now guiding common public that go ahead, take Ozempic, you'll lose weight?
I think the government of India has come out with very good document very recently. I think the Drug Authority of India has come out with clear guidelines where they have said, I think this was published just 2 weeks back,
right,
where they have said very clearly that only a registered medical practitioner can prescribe this medication. So that is all I have to say. So,
Right.
you know,
So-
I think anybody outside the permit of this, I don't think that is the right thing.
And who do you think is driving the usage of these? Are these the pharma companies? Because of course they make a good amount of revenue for that. Are these patients who need them medically, or are these just folks who are looking to lose weight? Like, you know, because now it's an easy way कि आपको exercise नहीं करना है. आपको जो मन है आप खाओ, and you end up losing weight, which is actually a very unhealthy way of being thin.
Yeah. I would say there is, again, it's a mix of factors. There are some really genuine patients who come asking for this medication. Somebody who has obesity, struggling with obesity, somebody who has obesity along with, say, a type 2 diabetes, blood pressure, obstructive sleep apnea. But at the same time, you also have another group of patients who, unfortunately, you know, with the influence of social media and the, you know, hype and everything, they do come to us. But I think, again, as clinicians or doctors, I think it is very important that I tell them what are the realistic expectations from this medication. It is important to realize that these medications do come with complications, and some complications are quite serious.
Can you talk more about complications, because everybody who's listening to this should know that if you're looking for a quick, easy way to lose weight, you also have to go through these complications.
Exactly. So what we see in our practice is about 15 to 20% of the patients will have some sort of complication. It might be a very mild side effect, or it can be a serious side effect. The common side effects are mild. When I say mild, you know, these are GI disturbances. So they'll have feeling like nausea, vomiting. उनको diarrhea भी हो सकता है, उनको constipation भी हो सकता है. In severe diarrhea, severe vomiting, patients can get dehydrated, which can have an effect on their kidneys. Remember, these were anti-diabetic medications.
Right.
So now we are using them for weight loss, but they will end up doing their original effect sometimes. So there is a fraction of patients जिनको hypoglycemia हो जाता है, जहाँ उनकी sugars low हो जाते हैं, and that is a life-threatening complications.
And in that case, do you stop suddenly? What do you do?
No, we will have to stop probably. We will have to assess the patient. अगर वो diabetic patient है, if he is taking some other anti-diabetic medications, probably I'll have to reduce the dosage of those medications. But if he is a non-diabetic and using this injection specifically for weight loss, then probably या तो मुझे dose reduction करना पड़ेगा, या तो मुझे simply वो medication stop करना पड़ेगा.
और ऐसा भी हुआ होगा कि आपने मना किया होगा and they have procured it from somewhere, they are taking the medicine and then they come to you.
So unfortunately, you know, that is not in our control, but we do get such cases once in a while. In addition, there is a risk of pancreatitis, which is again a serious complication. It can cause gallstones and gallbladder related issues. And again, it comes with an advisory. These are not meant to be given to patients who have either a personal or family history of thyroid cancers, or when we say MEN2 syndromes, which is medullary endocrine neoplasm type 2.
Can you explain it to us in layman language?
Basically क्या था? So when the researchers were doing trials for these medications, especially in the animal models. Now this effect has never been, ये किसी भी human trial में दिखा नहीं है, and even in our practice we have not seen this. But when they were doing these trials in animals, in some of those animals, especially in rats, they used to get thyroid cancers.
Oh my God.
And that is why even if you go on a US FDA website, it comes with a very clear warning that if somebody has a personal or a family history of specifically medullary thyroid cancers, these medications are not for them, because we don't know what is the long-term effect. So we have good short-term and mid-term data, but हमारे पास इसका long-term data अभी भी नहीं है, because these medications are still new. So although they are good medication, even I am worried to prescribe them for a long time till good data comes to me.
Right.
So in my practice, typically I advise patients to take it for maximum 2 years, and after that, you know, if it's required for a specific cause, maybe मैं endocrinologist को involve करता हूँ अगर वो type 2 diabetes के लिए है, so in that condition probably they can continue it for much longer. But when it comes to weight loss, in my practice I don't prescribe it beyond 2 years, because I simply don't have the long-term data, and I can't tell my patients, you know, what is going to happen if they take it for say 8 years, 10 years.
And what is the jab style like? How do you take it? जब आप बोलते हो 2 साल तक, is it monthly? Is it weekly? How does it?
These are weekly injections. And again, coming to your first question, जहाँ पे you know people are just taking it randomly. ये medications को हमको gradually increase करना होता है उनका dose. So we start from a very low dose and we go to a higher dose, and generally a transition 4 to 6 months में होता है.
Okay.
Now again, that is very important, because हम क्यों जाते हैं slowly from a low dose to higher dose, because we are trying to see if they are getting side effects and complications.
Right.
और अगर उनको side effects और complications होते हैं, I have to probably keep that patient on a low dose rather than on a high dose.
Self-medication is not advisable.
It's very, very dangerous, because आप directly high dose पे जाएंगे, and what you are telling about your friend, probably I don't know what dose she was started on, but that can have consequences and side effects.
Right.
So self-medication is strictly avoided.
No. Yeah. And what age do you recommend that people start? So अगर कोई 12 साल का है, 15 साल का है, is there an age limit to these medications?
So in practice, I think anybody who is adult, so 18 years and above, is where we would normally prescribe it. There is a lot of research that has been done in a 12 to 17 year age group, what we call as adolescents typically. Right. And again, from US FDA data, they have been approved to treat patients between 12 to 17 years who have obesity and who have obesity associated comorbidity, which is type 2 diabetes. But again, I don't prescribe medications for these patients. अगर कोई ये ग्रुप में पेशेंट है, I would rather send this patient to my endocrinologist, because first of all मुझे ढूंढना है कि इतने यंग एज में उसको ओबिसिटी क्यों है. So I have to rule out, my endocrinologist has to rule out a hormonal cause or any other factor that may explain the weight gain and say a diabetes in that subgroup of patients. So in a very small subgroup of patients, these medications can be prescribed in that group, but again, ideally an endocrinologist is the right person who should be doing this.
Right.
Not
Thank
even
you.
a bariatric surgeon.
So you go to an endocrinologist first, understand your body type,
Exactly.
understand what are the problems that you might be facing,
Exactly.
and then go about taking the
Exactly.
medicines.
Exactly.
Just don't believe your nutritionist or your fitness influencer
Yes.
when they are saying that.
And we have a multidisciplinary approach. So these groups are generally vulnerable, 12 to 17 years.
Right.
These are adolescents. So it's very important that there is a dietitian or a nutritionist inputs. We also send them to behavioral therapist, because we have to understand how they are going to get affected by this medication, and then obviously the endocrinology inputs that come in. And again, important thing is they also have to do a lifestyle change, which is very difficult in that subgroup of patient. मुझे किसी adult को बताना very easy रहता है, मैं थोड़ा डांट भी सकता हूँ as a doctor, but I think in that subgroup of patients we have to be extremely careful.
Right, thank you. And do you feel that the entertainment industry in India has even ruined it more for youngsters? Because in India, people are very influenced by influencers, by celebrities, and whatever they are doing. Like, we have seen a couple of celebrities in Hollywood get suddenly thin, and everyone is like, hey, it's Ozempic, and we have these doctors making videos, this is Ozempic. Do you think that they also need to be very careful about what they put out on social media?
I think it is difficult. We don't have control over that, frankly. I think as individuals, we have to trust our doctor more than what social media tells us. And I think, again, I think the parents play a very big role in all this. Friends play a very big role, typically in young adults. I think we have to just be mindful that not all that is put out in social media is right. So we have to understand that when it comes to health and when it comes to taking medications, I think it's best to link with a physician or a clinician and do the right thing, because it's after all your body, your health, and your health is absolutely important.
So when patients start these medications, do you see a change in how they approach their food, their lifestyle, for people who actually want a change?
So yes, definitely. So these drugs are very good, don't get me wrong. So what we have seen is, once you go on this, definitely the hunger cravings go down.
The food noise goes down.
Exactly. The food, there's a lot of neurohormonal effects that happen. So the food noise goes down. It reduces your gastric emptying. So आपके stomach में से जब food intestine में जाता है, that process is slowed. So you always feel full, and that is why you don't, eat less. And that is how this medication works. It also increases your insulin, basically it reduces your insulin resistance. So it has an effect on metabolism also. So there are a lot of factors which play, and typically that is what will make a patient, lose weight. So if done in a right manner, these medications are very, very good.
And who is the ideal candidate for these from a medical standpoint of view?
So any adult, when I say any adult, anybody above 18 years of age, if they have a BMI, body mass index of more than 30 kilogram per meter squared, and if they have obesity, these medications are for them. Similarly, anybody who is between a BMI of 27 and 30 and they have an obesity associated comorbidity, I'm talking about type 2 diabetes, hai, obstructive sleep apnea, hai, fatty liver, hai. Again, these are for those group of patients. These medications are not for somebody who is below 27 BMI. So when it comes to overweight category, so in an Indian scenario, I'll define somebody as overweight if they are between a BMI of 23 and 27.
23 and 27?
They are overweight, they are not obese.
Okay.
So again, I would say these medications are probably not right for them.
Yeah, so only obese and only when you are
Because in them, this the quantum of weight loss उनको जो चाहिए वो बहुत कम होता है, and that I think can be very easily managed by diet and exercise and lifestyle changes. I think the one message that has to go out of this podcast is these medications are not a magic pill. They are not a short-term gap arrangement. They do come with their own sets of issues and complications. So it's best to be avoided as a short-term gap.
When it comes to taking these medicines, do you feel that once you stop, the weight does come back? Have you seen that in results?
That is what the data and research tells us, and even what we see in our day-to-day practice. So typically, the moment you stop the medications, the cravings do come back in the next 1 to 2 months, unfortunately.
In 1 to 2 months?
Unfortunately. And again, what research tells us is almost good 70 to 80% of the patients will end up regaining all of their lost weight in the next 1 year.
If they don't change their lifestyle?
Yes, absolutely. And this is where commitment to proper lifestyle changes, regular exercise and good quality sleep is absolutely essential. So we have to understand these medications are like a walking stick. So if somebody is injured, we are going to give them a walker or a stick. It's sort of a physiotherapy to reach their goal where he is going to be up and about and mobile. Medications are also similarly, or when I do bariatric surgery, again similarly, we are giving them an opportunity to come back on track. But if you are not ready to make your lifestyle changes, nothing is going to work, unfortunately.
Correct. So जो सुन रहे हैं उनको ये पता होना चाहिए कि these are shortcuts. Yes,
Exactly.
you will reach your goal
Exactly.
of a weight loss, but you have to maintain.
Exactly.
You have to change your lifestyle to ensure that you are always sustainable
Exactly.
in that. And when it comes to, say, these patients who lose weight, how much is, there is a huge debate, right? How much fat is lost versus how much muscle is lost. Can you guide us on the same?
So it's mix of both. So when patient lose weight, yes, fat percentage is going to come down. But what research again tells us is, 20 to 30% of that weight loss is going to be muscle loss also.
Okay.
And in some subgroup of patients, even more probably. Very, very important that patient does their lifestyle changes and dietary changes. So again, a nutritionist's help is absolutely important. So I will generally link my patients to a nutritionist where we make sure that they are taking adequate proteins in their diet. And at the same time, they have to go in some sort of strengthening exercises where you do a bit of muscle toning and everything. So that is absolutely important.
So you should continue exercising even during these,
yes.
whenever you're taking these jabs?
Yes, absolutely, absolutely. And some worrisome data that comes is, say, imagine if I stop this medication and when I'm going to put on the weight again, unfortunately, it's the fat percentage that comes up if you are not careful. Yeah. So what we call as sarcopenia. So it is absolutely important that patients take these therapies under a proper clinician or a proper physician who is aware of these factors, and we need dietary inputs and we need a regular exercise schedule.
Very interesting about the dietitian point, right? I lost my dad 2 years back to cancer. He used to always tell me, "Arey, doctors na nutritionist laga dete hain. It's not required, Raghu, beta. Like, beta, it's just money. एक और डॉक्टर का पैसा मुझे देना पड़ेगा." Can you demystify that for all the elders who are looking into this, that आपको लगता है कि सिर्फ आप एक डॉक्टर के पास जाओगे and your problem will be resolved? It's not the case. It is interlinked, because I used to constantly tell him, "Papa, आपको प्रोटीन खाना पड़ेगा." And we being vegetarian, no, I don't need protein shake. I'll just eat paneer and it will be fine. So help understand our parents, especially, कि जरूरी है ये सब करना, ये सब changes.
So I think integrated care is the way ahead. So I worked in the NHS UK system for 7 long years. So almost any disease that we treat or any surgery or disorder that I manage, there is always a multidisciplinary care involved. So where, say when जब मैं bariatric surgery की बात करता हूँ, in my team every patient sees me, every patient sees my endocrinologist, every patient sees my nutritionist, every patient sees my behavioral therapist, and depending upon if there are other issues, say somebody has a pulmonology problem, they'll see a pulmonologist, they'll see a cardiac specialist. So integrated care is the way ahead. And diet plays a very important role in many disorders. No? You'll be surprised that means I was speaking with our neurologist some time back, and in fact he was telling that there's lot of neurohormonal issues with the gut. So he was telling me that some research has proven that sometimes patients who eventually end up getting Parkinsonism, okay, sometimes they will start having some gut related issues 4-5 years before also. So gut has a big role to play in each and every disorder. Today we know gut health is also related to cancer, especially colon cancers. So I think simple fact is don't neglect your gut health.
And explain gut health to us. Like the people who are watching, उनको लगता है अरे पेट दर्द है कि antacid लिया ठीक हो जाएगा, 3 दिन से खाना नहीं पच रहा है हो जाएगा. And I have seen people repeat this again and again. Like they feel that just taking an antacid or just taking a medicine is fine, and they do it for prolonged periods instead of going about solving the core issues. And that is a gut health is a new buzzword that we keep hearing, but demystify that for us.
Don't neglect your gut health at all. So
कैसे शुरू कैसे होता है ये? जैसे आप can you give us some examples?
I think see today with all the easy access to fast food, junk food, sometimes the dietary content of say fibers is less. Similarly, good quality vitamins, if you are not having your fruits, if you are not having your green leafies, vegetables and everything, it is very easy for your gut bacteria to get disrupted. Even a single course of antibiotics can disrupt your gut health completely.
Really?
And we have a concept of what we call as antibiotic associated diarrheas. So again, it's absolutely important that तुम्हारा जो नॉर्मल गट बैक्टीरिया है उसको प्रोटेक्ट करना है.
Just antibiotics ऐसे जो आजकल लोग ले लेते हैं गला दर्द हुआ.
It is dangerous. And if you talk with the nutritionist, in fact our nutritionist always tells me that Dr. Rishi, you'll have to at least eat 20 colors in a week.
Okay.
So she'll tell me that you choose different colored vegetables. You go to berries, you go for bell peppers, yellow, red, you have the green capsicum, green leafy vegetables, you go for orange, you go for mango. So you mix and match everything.
20 vegetables in a week is...
so 20 different colors. So you try to eat as much colors as you can, natural colors we are talking about, in a week, and that will be good for your gut health.
So it's not as rocket science as people make it to be,
exactly.
right?
It's actually very simple, and probably our ancestors used to do it much
right.
more better than us.
Because वो लोग millets खाते थे. I remember
Exactly.
मेरी दादी अभी तक वो बाजरा prefer करती है. जैसे
Exactly.
ठंड हो जाती है, she'll say कि change the way that
Exactly.
you eat. थोड़ा गुड़ डाल लो. Because where they say it, and I think that education of our ancient system is now coming back into the picture. But if you have to define or tell us in very simple words, this is how your plate should look like. So what would you suggest?
So a very simple thing is you divide it into 50% and 25%.
Okay.
So one set of 50% is going to be your protein.
So protein can be paneer, can be chicken.
Exactly, whatever suits you based upon your religious belief or personal. The remaining 2 portions are going to be 25-25. In that 125, I'm going to put it with fiber, your veggies and everything. And the remaining 25% are going to be carbohydrates. And when it comes to carbohydrates, I think mixing and matching is the best way ahead. So, someday you can have a normal wheat chapati, someday you can have, say, a bajra or jwari bhakri. You have easy access to millets now. I think government of India also is, pushing consumption of millets.
Correct.
For all the right reasons, I would say. And that is the way ahead. So keep it simple.
और इंडिया में उल्टा होता है. The 50% is carbohydrates.
Exactly.
And the 25% or less than 25% is protein.
So I think the way my nutritionist puts it, she tells all her patients that follow the KISS principle, KISS. Keep it simple and silly. Don't complicate your diet too much.
Right. And now let's talk about the second pillar of this conversation, which is doctors, and how important it is your role to play when it comes to a patient and hyper care of a patient, right? And how do you decide whether a patient should be treated with medication, whether they should be treated with a bariatric surgery, or just lifestyle changes?
So again, lifestyle changes is the base foundation on which all therapies are going to work. Now, if somebody is just simple overweight or has mild obesity, I think these patients are best suited with dietary interventions, some regular exercises, some probably inputs from a behavioral therapist. Uh, Moderate obesity, when I say moderate obesity, somebody who's between a BMI of 30 and maybe up to 40. I think these patients will need something in addition to the lifestyle changes, and I think probably medications is a fantastic adjunct to help patients in this subgroup of patients who struggle with obesity. When it comes to bariatric surgery, I think I offer this to patients who have severe obesity. So simply or morbid obesity is how I would put. So anybody with a BMI of more than 40 in a Western context or a BMI of more than 37.5 in an Asian or an Indian context. I think these patients are best suited with bariatric surgery because the quantum of weight loss that they want is much more.
With the rise of these the conversation around surgery also changes. आपके पास लोग ऐसे आते हैं, नहीं नहीं सर कर दो ना, दे दो मुझे Ozempic, it will be easier for me.
So again, like I told you, the patient decides. Okay, my job is to give them options. So if somebody is above 40 BMI but wants to try out a medication, I would not deny that factor until unless there is a contraindication to that medication. What again research tells us is eventually, if the medications benefit them, fantastic. But then what again we know that the quantum of weight loss needed for that subgroup of patients, they will eventually come back to me ultimately at some point of time. So you have to be a bit choosy and picky in where when are you going to offer. Now yes, like patients do come back to us. Somebody who were contemplating bariatric surgery before would want to try out medications. There's no harm in doing that, absolutely. In fact, we do use medications to our benefit sometimes. So imagine now if somebody has a BMI of in excess of 50 or 60, they are very, very big. Right. So when doing surgeries in them is very, very tricky. So I sometimes would put these medications on GLP-1 or GLP-1 and GIP-1, help them lose about 10-15 kgs of weight loss, and I then take them for surgery. Okay. So I'm doing pre-operative optimization for these patients using medications.
Right. So you both are complementing.
Exactly. So see, medicine is where now, like I told you, integrated or multidisciplinary healthcare is the way ahead. So if as surgeon, I would say that I am not going to work with medication, I think it's wrong on my part.
And do you feel that people who have, on the other side, right, people who have undergone surgery and later on they want to use these medications, is it safe for them?
Again, we have to use it in certain specific scenarios. Now, even in after bariatric surgery, about 10 to 15% of patients may sometimes come back with weight regain. Okay, or there is a small subgroup of patients who have inadequate weight loss or they plateau down in their weight loss journey. Now, in this subgroup of patients, we do incorporate this medications, and as a bariatric surgeon, I am absolutely happy because say 10 years back, I did not have an option in patients who may not respond as well to a bariatric surgery as before. Now I have an option with me where we do start them on these medications, and in some subgroup of patients, if they do again, first of all, we have to sort their lifestyle changes, right? Because most of the patients who regain weight after bariatric surgery, what data tells us is 75% of the times there has to be an issue with their diet and probably their exercise schedule. So once you sort that out, and if they need help with medications, we do prescribe them. So monitoring is absolutely important. So you don't self-medicate. You go to a person who deals with bariatric surgery patients, and then under their guidance, they can always start this medication.
So when it comes to ethics and responsibilities now, since you just said that there is a marriage between medicine and surgery, right? You need one to complement the other. Do you think there is also a disagreement in the medical community when it comes to taking these?
Again, it's an individual decision. So, some doctors who are a bit cautious, and I would say I'm one of those cautious doctors. But, some doctors are reasonably liberal when it comes to prescribing these medications. I think nothing is right or wrong as long as you are monitoring the patients, you are taking all the care, and the patient is aware of all the risks that come with if that information is passed on to them. I think both approaches are reasonably okay as long as it's going to be under a guidance and monitored therapies. then it really does not matter.
So educating the patient is very important before you start
Absolutely
them.
important. I think as clinicians, as doctors, I think it's absolutely important for us to tell them each and everything. See, as a surgeon, when I advise surgery to any of my patients, I make sure I go through each and every detail, every minute detail, even a complication which is going to be 1 in 1000, I will end up explaining that to patients. So as surgeons or as physicians, we work on a similar concepts of an airline industry.
Right.
So a pilot in their cockpit does lot of checks,
Yeah.
and there are multiple systems of checks. Errors will happen then when big accidents will happen when multiple errors happen all together.
Yeah.
So
Multiple
we
failures.
work on the same principle. We have multiple checks and systems into place. So my job is to keep on telling them and reinforcing them each and every issue, because if they know what is going to go wrong, the moment something happens, they are going to come back to me much earlier rather than slightly later.
We have also seen the doctors of bulimia, anorexia specialists, right? They are raising concerns about the usage of this, especially because how it's marketed.
Yes, absolutely. It's scary to a certain. See, these are, I would say, vulnerable individuals. They already have a very, I would say, disrupted relation with their food. And if there is misuse or abuse in this subgroup of patients, it is going to have a catastrophic effect. So again, as clinicians, as doctors, we have to be extremely careful that especially in this subgroup of patients, we don't prescribe these medications without a multidisciplinary team being involved. When I say multidisciplinary team, I need to make sure my behavioral therapist, a psychologist is involved in this care. I have a nutritionist involved. Because it's going to cause worsening of their already abnormal behavior with food.
Right.
So, it's a scary scenario.
We have seen, right, the prices have come down and there is a global shortage of Ozempic. Like, what do you think is going to be the effect of that in India, especially? Should we be concerned?
I think so far in India, we haven't seen that. See, I was in UK till 1.5 years back, and sometime in 2022, 2023, I think in UK, some European countries as well as in US, I think there was a definite shortage of this because of off-label uses, black marketing and everything. And then there was a shortage for the genuine patients. These were diabetic patients
Right.
for whom these drugs were actually advised. But then I don't think that problem we have seen so far in India.
But ऐसा हो सकता है कभी?
Now say
Because
tomorrow if all of a sudden the demand surges, typically with when we go to tier 2, tier 3 cities, and if all of a sudden you have more demand for these medications, yes, that is always a possibility. But I think that is where the regulators have to step in. I think we as clinicians or physicians have very little control on that.
And what does it do? What does this entire access to these medicines, to these Ozempics of the world do to the food industry, to the diet culture? Because now I've surprisingly we started seeing this. You go to a food court, you used to see chole bhature and you used to see pizzas, and now you see everything with a protein.
Yeah.
Right? Even your coffee has protein. So what is it doing to the food and diet culture in general?
It's going to definitely cause some disruptions is what I can say. And there are some research or data already coming from US, I would say. So definitely I think a lot of the processed and fast food industries will have to make changes. And I think as more and more people start using this medication, and definitely that change is going to come with they have to adapt is how I would put it.
What is the realistic cost for these medicines in India for patients?
So I think based upon the type or brand that you go for and the dosage of the, I think the cost will vary between anywhere between 5 to 6,000 to say 25,000. I'm talking about a monthly cost. So the
5 to 6,000 to 25,000.
25,000 based upon the brand that you go for and probably the strength of dosage that you go for. So again, these are costly interventions. The cost reduction is welcome because I feel it's going to in a way democratize access to these medications. But at the same time, we have to be careful that it does not increase the misuse of this medication.
So now tell us that insurance often treats weight loss procedures as cosmetic, right? And it doesn't cover them. Should this change be given their impact on overall
So
health?
it's actually a misconception.
Okay.
So IRDAI, which is the Insurance Regulatory Authority of India, in 2016 has approved bariatric surgery under
Okay.
insurance. But they have certain stricter criteria and they do follow certain old criteria, but it's still a welcome change. So if somebody has a BMI of more than 40, the bariatric surgery will get approved for them. If somebody has a BMI between 35 and 40, but they do have an obesity associated comorbidity, and they typically go for 4 factors: uncontrolled type 2 diabetes, some cardiac issues, obstructive sleep apnea. In that subgroup of patients also, they will approve bariatric surgery. So far, the insurance have not approved medications.
And cosmetic, and because of cosmetic usage
Yes,
only.
yes. But then I don't think that, in a good chunk of patients, we are using these medications for the right medical reasons. And I think somewhere, I think the insurance probably need to adapt and incorporate, because a healthier patient is going to be much better for them.
Right.
A patient whose diabetes gets controlled, he is going to have lesser hospitalizations in future. So I think it's a win-win for everybody. So,
And what do you think, what is the biggest trend that worries you, Dr. Rishi, right now? Because of the rise of these medications, or because of the education that is being given to young consumers, especially Gen Zs, right? Everybody now says that, oh, you're fat, just take a jab.
I think we have to move away the discussion from body image to health. I think if you prioritize your health, I think this short-term jabs or quick fixes is going to go out. I think for anything that has to sustain in the long run, good lifestyle changes is the way ahead.
So thank you so much, Dr. Rishi. I think this was very enlightening for all of us, especially understanding that even though so many medications is present and available in the market, what is most important for anyone is the fact that you need to do lifestyle change. You need to make changes. You need to exercise. You need to eat right in order to be healthy. It's just jabs are not going to do wonders for you. So now with that, I have the last question for you. And you tell us, will we move forward towards combination approaches, which include medication, surgery and lifestyle together? Or is medication only going to win?
No, I think it's going to be an integrated approach, and that is what we are already practicing. I think if you go to most setups in India, the good setups, I think they are already following this integrated approach. So I practice in Fortis Hospital, Mumbai, and if you come to our setup, like I said, I already work with my endocrinologist, we work with our nutritionist, we have a behavioral therapist, a psychologist, and as and when any other specialty is required, we would incorporate their help also. So I think in each and every disease, it is similar to how you would, prescribe cancer therapies today.
Right.
You get an oncosurgeon involved, you get an oncologist involved, there's a radiation therapist, sometimes a plastic surgeon to do the reconstructive bit. So I think obesity care or care of any disorder or disease, I think integrated approach is the way ahead. These practices have already changed abroad. I think we should high time that we start incorporating and embracing them in our practice.
So if you have to give us some last advice for all the people who are watching, our patients, anybody from the age of say 18 to 50 plus, our parents, what is that you would leave us with?
I think make the healthier choices. So lifestyle change is the tenet on which each and every modality, be it my surgery, be it medications, or be it any other therapy, is going to stand the test of time. So if you are not willing to make a lifestyle change, nothing is going to work. No therapy, no medication, no surgery is a quick fix. They are not a magic pill at all. So as long as you are not ready to make a change to yourself, none of these therapies are going to work. So this will work the best when patient incorporates those changes. Then the effect of this medication or my surgeries that I do, they'll get the maximum benefit out of this. So it's absolutely important that the first thing that they have to make is, first you have to start deciding that I am now going to make a journey towards a healthier myself, where I am going to incorporate all the right things when it comes to my diet, when it comes to my exercise, and when it comes to my lifestyle choices, I would say.
So it's just like, you brush your teeth. You do it every day.
Exactly.
So you need to think about yourself, think about your health, and work towards it every day.
Exactly.
Thank you so much, Dr. Rishi. I think this was very enlightening for all of us, and thank you for being there on Find Out With
My
Ragini.
pleasure, and thank you for calling me today for this part. I hope that this message reaches to the general population, and they make all the right choices for themselves.
Right, absolutely. We hope so too. Here is something nobody in your Instagram feed will tell you. 70 to 80% of people who stop these weight loss injections regain all the weight within a year. And that is why your gut health is not just a buzzword. What you eat, how diverse is your plate, and whether you're getting enough fiber and color, it all directly affects your metabolism and your immunity. No jab, no surgery, no shortcut works unless you are ready to change your lifestyle. That is one thing Dr. Hrishikesh made crystal clear today. I'm Ragini, and thank you so much for watching Find Out with Ragini. Share this with someone who needs to hear how you can take care of your health and not just listen to buzzwords, which is prevalent in the market today. See you in the next one.